of programs that will run every Saturday in May and June, starting around noon. Who are we? We are part of the Global Pain Association, and we have panelists who will come to you every week dealing with issues that affect families, their loved ones, and others who are struggling with what is a very, very difficult issue. My name is Ron Aaron Eisenberg. I'm delighted to be your moderator today. I spent a lot of years in my career moderating similar kinds of programs, dealing with medical issues, health and wellness, caregiving, and a whole lot more. So this, for me, is a way of coming home, dealing with an issue that is so close to so many people. I have a master's degree from The Ohio State University and a law degree from George Washington University, but most of my career has been in broadcasting, and it's really what I like to do. What we're going to do is bring you free virtual programs every Saturday at noon, bringing a panel of guests who are experts in the field, and you'll get a chance as well to ask questions. Just send your question to info@globalpain.org, info@globalpain.org, and we'll try to work those questions into this program as well. Today's topic is COVID-19, the effect on chronic pain and its toll on families. We'll tackle many topics throughout this series, including finance, yoga and exercise, social support, nutrition, coping with pain, art therapy, myths about chronic pain, and those are just to name a few. All of these shows will be on the Global Pain Association Facebook page, and you can watch them live, or you can download and watch them later, share them with friends and neighbors and others you think may be interested in a particular topic or more. We have sponsors for this May 2nd program who help underwrite the cost of providing this service on Facebook. Advanced Pain and Spine Center, and the president of that organization, Dr. Ellen Lynn, will be joining us in just a couple of moments. That was Dr. Lynn bouncing to the front. New technology in this school. She's hanging out somewhere in an undisclosed location at her home, and we're delighted to have her. If you want to get more about Advanced Pain Doc, just go to www.advancedpaindoc.com. Another sponsor is the Eisenberg Group, a communications and public relations consulting firm specializing in health and wellness and medical issues, and the firm also deals with crisis communications. Website, www.eisenbergpr.com. And the Global Pain Association, www.globalpain.org. And those three have gotten together to help underwrite the cost of this first program. And now we're honored to welcome as our first presenter, historic moment here for Dr. Lynn. She is the very first to come forward as a moderator and as a participant in one of our series here on the Global Pain Network. She's founder and president of Advanced Spine and Pain Center, doctor of medicine from the University of Texas Health Science Center, a well-known speaker and lecturer. She works with multiple companies, including Nevro and Stimwave, and primarily her expertise has been focusing on pain and chronic pain and how individuals can deal with that. She is president and founder of the American Society of Women in Pain Medicine. And if I go on and read all her credentials, we won't have time for the rest of the program. So we're going to turn to her and welcome Dr. Ellen Lynn, and virtually put your hands together. Dr. Lynn?
Hi, I'm Dr. Ellen Lynn. Thanks, Ron. I'm happy to be here. It's about the same time a year ago, I was invited to host a Global Pain first seminar, but it was a live seminar. And I was delighted to see all the talent and all the people who are very dedicated to taking care of chronic pain patients in our community. And because of the pandemic right now, we are happy to bring this to you as well. I know we can't be in the same space, but hopefully this will connect us together to be able to help each other. So I would love to just try to connect the dots a little bit for those patients who are suffering from chronic pain during this pandemic. It must be really, really hard for the patient and the families. And I'd like to be able to bring some light to this situation as our first lecture. So next slide. I don't know how to, I want to go to the next slide, but anyhow, there should be a slide that will open up again in a few moments here. So I was surprised looking at how many chronic pain sufferers in America. So there is something like 116 million Americans that live with some kind of intractable chronic pain. And that actually surpasses cancer, heart disease, and diabetes all combined in America. So that's according to the CDC guidelines. And they have compiled the numbers together. And that shocked me last year when we were doing a live conference in San Antonio. So how do we combat this type of, this is an epidemic in our own country, and we must be able to find awareness and raise awareness to the general public about this illness, just like diabetes, just like heart disease. So next slide. The many different causes of chronic pain include the most commonly known osteoarthritis, as well as rheumatoid arthritis, diabetic neuropathy. We have a lot of diabetic here in the Bexar County region. So that comes very common in this region. So cancer pain as well is another cause. Chronic low back pain, I think most of us sometime in our life will be able to experience what that feels like. Migraine headache, fibromyalgia, and visceral abdominal pain and shingles pain. And multiple sclerosis pain is in the category of neuropathic pain, but it can be very, very painful as well. And now we have a lot of soldiers coming back from the Iraq war and Afghanistan war, and there may be amputations involved during the attacks, and the amputation pain is also considered the type of chronic pain. Next slide. So what is chronic pain? So according to the National Institute of Health, chronic pain is the pain that lasts more than 3 to 6 months. And the pain will last more than what the surgical post-op pain would be. But if we don't know the causes of pain, your physician does not know how to categorize this pain. It doesn't mean that you're going crazy. It's because a third of them, we have no idea what causes chronic pain. But don't worry about it. Don't start to think, okay, I am really going, not so well mentally. It is what it is. We have limited capabilities. Still, 90% of the brain, we still don't understand as physicians and research scientists. So that doesn't mean that we can't treat these chronic pain and make a better life and better function, and to be able to have some kind of meaning despite suffering from chronic pain. So the next slide. So the socioeconomic cost has to be talked about. Why do we have to jump into bringing awareness about chronic pain and treat chronic pain very quickly and efficiently? Because chronic pain cost Americans $560 billion with a B a year in direct medical cost and productivity that's lost through loss of jobs and work and disability programs. So in between the year of 10 years, 2003 to 2014, they have estimated also 9% of the suicide patients, they suffer from chronic pain. So that, that really brings it close to heart when I look at the statistics giving this lecture. And now we're talking about COVID-19. There are a lot of deaths around, a lot of fear. And so what does that look like, right? Does that really mimic chronic pain? Because in my mind, there's a lot of similarities and we need to talk about it because it's scary times. So the next slide, you'll see that this is a map I just downloaded and screenshotted from online as of last night. And there are over 1 million cases in America now with COVID-19. And out of those, 62,000 have deceased. And that's somewhere around 6% of the total cases that are positive right now. And Texas, as you can see on the diagram, and I was surprised, it's purple. So purple, look at New York, look at California and Florida. Purple is, we got a lot of cases, right? We have a lot of people here, but we also have a lot of cases because we have big international airports. And so that's that's a concern of mine, and but we are doing all the right things in the state of Texas because we have great leaders to be able to bring us down with the cases and maybe minimize the total death rate. So next slide. So let's go back to the cost again. So it's very costly for us to run and take care of chronic pain patients. It's also very, very costly to be able to take care of this acute, very fast, rapidly spreading pandemic. It's somewhere estimated between $214 to $654 billion in just the hospitalizations and medications and intubations cost. So we have no idea what the indirect cost is of COVID-19. So with the third of the population now that we know have some kind of chronic pain, and then another large population that could be infected or have been infected with COVID-19, the cost to our next generations would be very tremendous. So this is why we're bringing awareness, bringing help, bringing all the experts together in San Antonio and beyond so that we can help chronic pain patients. So next slide. How do I help myself? If I was a chronic pain sufferer or maybe I'm a family member of chronic pain, what do I do to kind of help myself during this pandemic and help my family members? So it's very easy, right? This is still common sense, even if you're not a chronic pain sufferer, but especially if you're a chronic pain sufferer, because there are more anxiety and depression and worries involved. We must be able to have some kind of routine during this pandemic. I mean, even with me, I'm a very routine-driven person. I'm starting to realize I'm not waking up at regular time and I'm not eating at regular time because of stress. I don't go to sleep at regular time. So because our cortisol level is stimulated by the sun and by your sleep-wake cycle, we must do this. And cortisol level in chronic pain patients have already been diminished and maybe in different curves, right? So usually the cortisol level is really high during the day when you wake up, so it wakes you up. Chronic pain patients, they may peak at 11 o'clock in the morning and doesn't go away until late into the night. That's right, the sleep-wake cycle is messed up in chronic pain patients. And that doesn't help your mood, it doesn't help your energy. So please get some kind of routine, set your alarm, it's easy. And there's a lot of TV, a lot of scary news out there. It's not that I don't want to be informed, but look at your sources. Do not have the TV turned on all day. I limit news to just an hour a day or less. That includes my cell phone and my smart devices. And so turn off your news because that's going to decreases your anxiety and get the sources of your information for COVID-19 from CDC, from your local communities, and from the NIH. And another thing is reach out to your physicians. They're still there, even though their offices might be closed and maybe some of their staff members have been infected, but they're still doing telemedicine and they're there to answer your questions and phone calls. Set up your patient portal. I think that's really, really important because they may have furloughed their employees and phone services have been disconnected. We're all online to use the traffic. And so it's very difficult. So if you set up your patient portal, that's going to be very helpful to communicate with your pain physicians, with your primary care doctors. So whatever you're suffering from, that can be resolved. And it's incredible. I would never think that I would be able to diagnose cancer over telemedicine. Just in the 2 months I've been shut down to see real patients in the office, the 2 cancer patients I have diagnosed. So, please keep that in mind. So the next thing is self-help, right? And I'm starting to do this as well. I'm not an insomniac. I can sleep just about anywhere. And I'm finding the last 2 months, I'm having trouble sleeping. So how do I mitigate that? I take melatonin just to kind of help me go to sleep, turn off all my devices at least 2 hours before I go to bed. And also the worries that I have are turning into dreams And sometimes you wake up in the middle of the night, worry about those dreams. Instead of worrying about it, go and just write it down on a pad, a paper right next to your bed, and then leave it, okay? And then you can deal with it tomorrow. There's always tomorrow. Don't deal with it right now. Or if you worry about something during the day, write it down your a little notepad and put it in your kitchen and just let it be, okay? And walking and exercises is very important. Now that we're getting less and less exercises, and even with me, the gyms are closed and I can't get to them, and I don't have the motivation. And so how do we take care of that? Make sure that you can maybe even do a virtual walk with your family member, and maybe talk on the phone when you're walking, and that makes you feel better. And do a live yoga, whatnot. Our yoga instructor is coming on in a few weeks, about the same time, Saturday at noon. And so hopefully we can utilize that to decrease your chronic pain. So the next slide, we see that chronic pain is very complex. It touches on all kinds of major part of medicine, whether it's cognitively, environmental, genetically, and medically. These chronic pain patients, obviously, they have decreased production. So sometimes they feel anxious because they might be losing their jobs, depression because they feel like maybe feeling a little useless. And the family members sometimes might say, hey, why don't you just snap out of it? There's nothing wrong. You don't look like there's anything wrong with you. What's wrong with you? Snap out of it. So then they feel hopeless. Even their family members are giving them grief, right? So then the vicious cycle continues to give the patients more pain. So how do we break the cycle? So next slide. The mood disorder needs to be broken, and sometimes it's a positive feedback. So I get anxious right now in the last 2 months, and I'm trying to tell myself the anxiety, how do I get rid of that? And everybody processes anxiety and depression differently. For me, I'm going to try to find the answer. So why is COVID-19 also attack young people? So for you, it may be I need to reach out to somebody that I worry about who's also in their 50s and make a phone call. And maybe that will decrease your anxiety. Whatever it is, find the solution. Don't just sit there and worry about things, because that's going to perpetuate itself. So we got to be able to reach out to other people, not just in our families, but also in the community. And I think Global Pain Association will bring a way to make people connect positively, and decrease the anxiety and the mood disorders, and maybe even substance abuse can be reduced. So the next slide, traditionally medical care is focused on that physician, right? So that doctor, do something for me. I'm hurting. What should I do? And what medicine can you give me? What surgeries can you give me? Procedures and whatnot, right? So same thing, the same concept kind of exists in our modern day practice of medicine. So I'm going to try to see if we can change the mindset a little bit. Instead of making that physician in the center of the healthcare focus, the next slide will show you that we need to focus on the patient. Okay, so the patient should be the team leader in this approach. So if the physician is giving you orders to take some nerve pain medication, then the nurse should also jump in and say, how are you doing? How are you taking it? Is it hard to swallow because you have Sjogren's disease? Is it hard because you can't open the pill box? Can the occupational therapist help you open the pill box, or can we divvy up your pills in a pill box? And the physical therapist can say, hey, can you travel? Do you have any problem walking just to your mailbox, or to be able to transport yourself and figure out how to get to the physician's offices? And if you have about to lose your job or have lost your job, can the vocational therapist help you find something that you can enjoy and meaningful that you can do? So it should be patient-centered, patient-focused, and that patient needs to be the quarterback per se, and direct his or her own care. So next slide is going to show you the 12 ways of communicating, the 12C approach. So now we have all these team members helping this beautiful person, and how do we communicate? You got to be able to use effective communication. If the patient does not tell the physician, hey, you know what, I cannot take this pill because it's too big, or it has a lot of side effect, or the patient calls a doctor's clinic, the nurse does not get to the messages to the physician. So again, it's really, sometimes it's very difficult for my older patients to learn patient portal, but I always try to encourage them, get one of their younger family members to get the patient portal set up so that you can communicate easier, because not all the messages get to the physician. Just mind you, there's a lot of things going on, phones going off, and the nurse might be giving a injection or a vaccination, and they just cannot remember, oh, here, Mr. Smith called, and let's put it in Dr. Lynn's box so she can address the side effect issues. So we got to be able to collaborate with each other, and the commitment has to be there. Okay, so next slide. So just like chronic pain patients, we need a village to take care of the patient so they can be functional, they can be productive, they can they can live a meaningful life despite the pain. So same thing in COVID-19 epidemic period of time, we need to be able to work together, because this is going to spread very slowly, because the state of Texas is really broad and very big. It's going to spread. I hope I'm wrong, but it probably will slowly spread until December or beyond. So we must be able to communicate with each other and help the community survive this. So the next slide will show that hopefully as a team, we can make a great impact in the chronic pain sufferers in America. So we're trying to bring the resources to the community because of that. And if the resources are lacking, let us know in Global Pains Association, and we can be able to help you plug some of these into our seminar and on our websites, and be able to serve the community who are suffering from chronic pain. And if you are a leader, even if you are cooped up at home and feel very isolated, send us an email so that we can maybe reach out, to you and then brainstorm with you the resources that maybe you have, and be able to spread that to the next person who suffers from chronic pain. So the next slide provides a COVID-19 resources. There are chronic pain resources and COVID-19 resources that Ron's going to put up on our website, on our Facebook, so that you can go on and be able to research what your needs are. And one of them is Global Pain on the top, of course, but there's also national suicide hotline. Remember, there is a large percentage of patients feels really isolated, already suffering from chronic pain and very lonely now with the COVID-19 house arrest. So reach out to those members in your family and your friends if they suffer from chronic pain, to give them that phone number, and just in case they need to talk to somebody 24/7.
Thank you. Dr. Lynn, thank you very much.
You're welcome.
We really appreciate it. We've got some questions which we'll bring to you after our next panelist. We'll put the two of you on together to answer some of these questions, and we really appreciate you taking time. We had one viewer ask what I'm drinking. It is not a can of beer. It's seltzer water, just in case you wondered what's going on here. We're not into the beer yet. So on we go. Dr. Lynn, thanks. Very, very informative. We're going to move now to our next presenter, Carla Riddings. She's got a BS degree in elementary and preschool education from Eastern New Mexico University, has a master's in guidance and personnel from Memphis State University. She's a retired school counselor and administrator, 42 years in education and working with parents and students, and served on the NEISD District Crisis Team as a trainer in crisis and trauma counseling.
We're having technical difficulties with Carla. Why don't you?
We're having technical difficulties reaching Carla. Our producer, Gene Eisenberg, just came to me. So, Dr. Lynn, you're still here. A couple questions for you.
Sure.
from our viewers. One viewer asked, "What about scheduling time to journal? What do you think of journaling?"
That's a great idea. I'm not a journalist, but that's a great idea. I think journaling can help you process um, what you're thinking, your thoughts, right? And writing it down. And I have patients right now who are worried about their grandchildren across the country. They can't go and see them. And that was my suggestion, to write down their thoughts about what's going on in the world and what grandma's like right now and how grandma's feeling. And then that really kind of eases her anxiety and her pain. That's a
It's
great
been
idea.
interesting. There's nothing really good about this virus, but it has gotten more and more people into interactive media. So whether it's FaceTime or Zoom or any of the other Skype, people are now reaching out beyond the four walls in a virtual sense to touch their family. You've noticed that.
That's correct. And we are doing that a lot on a daily basis as physicians. We are using all kinds of different media, and some of them I have never even heard of before. And with the FaceTime with iPhones and Duo with Google, and then there is DoxyMe and Zoom, and now we have this platform. I think it's great to be able to be able to touch lives of other people without having to touch them.
Got another question come in from the South Side. This is a husband and wife who have a child, a teenager dealing with chronic pain. And they asked, they've read a lot about using both meditation and mindfulness as a non-medicated way to deal with global pain. What do you think?
That's right. That's really important. And we actually have a speaker coming up in a few weeks that's going to address that. And another speaker who's a specialist in counseling teenagers. And so Dr. Selena Shelton will be able to speak on that as well. But from what I know about meditation and mindfulness is that you are actually changing the chemicals and the part of the brain that makes you almost like an addiction to the negative thoughts. So it's something called the amygdala, and you can just shut me off if I get too nerdy. But
no, you're doing great.
But right behind your cheek, right here, the amygdala part of the brain is what makes us have addiction to anything, to food, to anything that we do that have addiction, pain medications and whatnot. So that part actually turns on when you have negative thoughts as well. And when you have positive thoughts as well. So you can overwhelm the negative thoughts just by thinking positively. So it's incredible. And so people who actually are trained as a professional to do this full time. And so we're excited to bring those professionals in the next few weeks to people.
Now we've got Carla up. We're going to put you on standby. Don't go anywhere, Dr. Lynn. Stay with us, and we'll come back to you at the end of Carla's presentation. I introduced her. We'll give you a quick overview again, and I think we need to mute Dr. Lynn so we get the feedback out of there. Sounded like the spaceship has landed, and we're now ready for Carla Ridings, who is a specialist in how children and families are adapting to and dealing with COVID-19. And Carla, thanks so much for coming on. We got to unmute you. Hang on, Carla. Okay, you're up. Talk to us.
Thank you for having me today. I'm delighted to be here, and I appreciate Dr. Lynn inviting me to be with y'all today. I want to talk to you a little bit about creating calm waters in a storm, not only for our children, but for yourself also. I am an MS. I've had MS for 34 years, so chronic pain is my friend. So learning to work with them, work with children when there's a lot of stress. And COVID-19 has brought a lot of new changes. It's turned our world upside down. Your family members may be experience more pain. They may be experience more anxiety. And so as a family unit, we have to work on this together. I worry about parents feeling that they are responsible for fixing everything. And in this time, you can't fix everything. Suddenly, in a home, you're not only a mom, but you're also social distancing from all your support systems, your colleagues, your peers, and if you weren't in the teaching field, you're suddenly a teacher. And for our grandparents that are raising children, they're having to learn new technology to help children learn. So there's a lot to it. So being able, and especially now that we're getting some situations where folks are returning, or they've had to work, they were, God bless them, the essential workers all along. They're balancing work and children and supporting the educational and emotional needs of their family, childcare, and certainly the financial concerns that many families are facing at this time. And along with that, the close quarterness. I mean, we all love our children, and this has been a wonderful opportunity for us to spend time with them, but you also need time for yourself. And that's one of the things in adults. I think it's important for us to understand that I dovetail with Dr. Lynn, the media exposure, be selective, not only for yourself, but for your children. You need to have them and explain to them in age appropriate terms. Set boundaries with older ones that they're used to being bombarded with social media, but help them set boundaries. Coping skills for parents, and especially for parents on the parents of chronic pain. I need you to practice self-care right now. You won't be able to help children if you're not okay. So you have to take time. And for those of y'all that are a teacher, I just want to point out that next week is Teacher Appreciation Week. So not only email that teacher that has had your child all year until you became the teacher, but you need to let your significant people know that you have teacher appreciation next week, and that surely should be worth not doing dishes. And by the time you get a week of that, you're right into Mother's Day, so you should be good for 2 weeks. So I think it's important for you to do those things, but I think it's also important for us to understand with children the ability that we need to be talking with them. We need to talk to them in terms that they're going to understand and is appropriate for their age. We need to be able to reassure them that they are safe and share coping skills with them. Mindfulness is helping them to visualize, helping them. The journal is a great idea for them to express that. Fear, you need to leave it up to them whether they want to share that journal. But if you have a child that you are seeing signs of depression, then you need to have real honest conversations with them. You need to keep tabs on exactly where they are and ask honest and direct questions in that. Reassure, especially young children, that we will get through this and that you're going to be there. If you see in young children that they may be throwing more temper tantrums or acting out more, that's usually a sign of worry or anxiety. And certainly it's real important for you to talk to them honestly and openly. So So for yourself, the routine is critical. For your children, a routine is critical. But in that routine, don't be so rigid with that routine that you can't alternate it given situations. With every classroom setting, teachers have to fly when something happens. A fire drill may interrupt. They may have children out. So those are things that I think it's important that, especially with online learning, they're not going to be able to sit there from 8 in the morning till 4 in the afternoon. Most of the school districts have come out with their communication. So you need to balance that. They need the skills, but you also need to balance that because they also need to have exercise along with you. They need to have time with their friends, whether it be through social media. It's tough when you have, especially teens, and that was predominantly who I worked with in my career. For teenagers, it's hard enough to go through that time of adolescence. But now COVID-19 has made it even harder. They're missing out on special events, being with their friends, sporting events, things that they will not be able to get back. So helping them to understand that and coming up with creative ways, and we've seen a lot on social media of how parents are having birthday parties with parades, and you need to think out of the box because we need to be celebrating. The positivity and the celebrations need to go on because life has not stopped. It's in a little different form, but for most of us, it hasn't stopped. So we still need to celebrate those things. For your teenager, help them understand that anxiety about this is normal. Remember that especially for juniors and seniors, they've got so much uncertainty. You've got kids who have worked for 12 years. We're getting ready to go to college. We're in the process of trying to get scholarships and financial aid. And suddenly their support systems are different now. So a lot of funding for next year, and especially if there's been a change of employment, these kids are moving to just survival skills. And their dreams, we need to help them keep alive. We don't know yet. I've checked with several colleges and universities. They're first developing plans, as you've seen through the media about ACCD, how they're using some of their federal funds. But they're first taking care of their current students. But I would assume that in the future, they'll be looking at SAT and ACTs have already been exempted for college admission. But remember, your juniors, it's key for them too, because they're applying for college after this year. So they have stress over how's this going to impact me getting into the school that I want to. Help them learn to be kind to themselves and kind to others. Practice mindfulness, activities that we've discussed, find creative ways to celebrate, and help them understand. This is real critical because teenagers feel they'll live forever. And it's real important that they understand in social distancing that there's a big difference between being fearless and not letting COVID-19 take over our entire life and being fearless about continuing on with life and being foolish and getting in situations where we're going to parties or we're not practicing social distancing. Those are things that as parents, we need to help them. I would encourage you, and if you'd put that slide up for me, please. I've given you a couple of websites, and these are websites that I garnered information in doing this presentation. But go to your local school district, whether it be San Antonio ISD, Northeast or Northside or Judson or Alamo Heights, or even one of the sites I pulled from is in Tarrant County in Fort Worth. All of your school districts are going to have under their guidance and counseling webpage they're going to have information to help you and help your child through this. Also, the Child Mind Institute is a great resource, and I've included the links to that. And on Instagram, there's a blogger called Blessing Manifesting. There's just a lot of positivity on that. It's short, it's real, the format of it is real easy for even younger children to understand. And then UNICEF for Every Child also has some information about coronavirus and how it impacts our young people. So I think understanding and talking with them, give yourself grace. The one thing that I would tell you, if you are a person in chronic pain and you're having to do things for your own work. I know I have a daughter. She's a teacher, special needs teacher, and she's spending 80 hours a week now rather than the 40 to 60 before. Because remember, our teachers are having to redevelop their whole format too. So she also has 3 young children. So she's trying to provide education for her 5th grader and then help her preschool and 3-year-old. So God bless you. All of you have a lot on your plate. Recognize that. What I would dovetail with what Dr. Lynn said, I think it's important that you do reach out to people. But what I would encourage you is have a plan, because all of us are going to get overwhelmed at some time. We're going to use grandparents. I retired this year, and my plan was to spend time with my husband, and boy, have we gotten that. The other was to spend time with my grandchildren. Well, I've missed birthdays, I've missed Easter, I've missed St. Patrick's Day, all of those things that my retirement was going to have in store. Remember that grandparents can be a great resource. Let them do some of those Zoom teaching situations. Zoom with the grandparents, let them work through it and give yourself a break. But have a plan for if you get to a point that you're stressed, not only with what Dr. Lynn said about reach out to resources, but recognize when you're getting to those stages of stress level and go into your plan. Who is the significant person you're going to contact? Talk to them beforehand and say, I need you to be my right arm. I need to be able to talk to somebody without being judged as to how can I not do this? How come I can't work? How come I can't take care of my kids? How come I can't do school with them? All of these new job roles that you have that outline so that when you have those moments, you know who you're going to reach out to. I admire and just respect all of the parents that have held the rope in athletic terms and kept their they've managed the rudder of their children's little boat. And as we go on, help them understand not to give up on their dreams. We will tackle that as we get through it and we get healthier. And as programs are developed to help them go on to college and universities or to technical schools, or if they were planning on doing internships, whatever their apprenticeships, whatever their goal was, help them to understand that they don't have to give up on that goal. It can still be something they're working toward because they need to have something they're working towards. I've enjoyed being with you today. I've done a lot of presentations, but this is my first Zoom one. So this has been, or not Zoom, but on this format. I've been Zoom teaching for my grandchildren, but those are things that I'm learning too. So old dogs learn new tricks. Dr. Lynn pushed me out in that water, and Ellen and everybody just was very kind. Ron and everybody was just so kind to say, okay, yeah, you can do it, and texting and saying, okay, well, you probably need to push this button if you're not getting it. So I appreciate all the panel and the technology behind it and everyone who helped make this possible.
Carla,
But
thank you.
let us help support you.
Thank you very, very much. The format we're using is Believe TV, which provides a little more flexibility than Zoom, and it's one that my wife discovered doing research on these various platforms. We've got a few questions. We don't have a lot of time left in this format, but let me toss out one or two to Ellen and to Carla. And one that I thought was very interesting, Carla, somebody wrote in and said that their daughter said that she's now having nightmares about a big monster coming for her parents. And they interpret that to mean COVID-19. What do they say to her? We got to turn her mic on. Okay,
I think reassuring children and teenagers that you are doing everything that is within the protocols to keep yourself safe. I know that I got a lot of feedback from kids who still reach out to me, and their concern is my mom's got to go back to work or she's going to, she won't have a job. And my dad was in the oil field and he's laid off. And I'm concerned about her going out. I'm afraid that I will lose her. So many times that will manifest itself in dreams. So I think that honest communication with children, that you are doing everything in your possibility, within your ability to keep them safe, keep the family safe, and keep themselves safe, even when they go to work. Talk to them about the safeguards that employers and that the state has put in place to make sure that that employees are safe. And I think one of the things, I have a lot of former students that are frontline. They are either CNAs because they got their CNA certificate in high school and they went straight into nursing homes, or they are CNAs in hospitals, or they're working the front line at HEB or at Sonic, the places that you've been driving through. Those are kids. And I would say to all of us, make sure those are kids out there, and a lot of them are out there not to earn money to buy new clothes or to get that prom dress. They're out there because the family needs all of that income. So be patient, be kind, be appreciative of all of the people that are out there on the front lines helping us.
Perfect. One last question. We're going to throw this one to Ellen. A viewer asks, Ellen, why did you start the Global Pain Association?
Well, it's because 15 years in private practice, it pushes me to be more efficient as a physician. Therefore, there's a lot of components that's missing in my practice. And I would write things down, and still it's not enough to be able to coach patients how to do mindfulness, yoga, exercises, psychological help and well-being. So we created this along with my friend Gina Eisenberg and Susan, Patty, and Selena. The list goes on and on. These are amazing individuals that are putting the resources together so we can make a very comprehensive care and a whole person, not just to eliminate your pain. Yes, I can eliminate your pain by putting a morphine pump in you, but that does not restore the human being behind this pain. So even if the patient is suffering from pain and the pain's eliminated, we still need to restore and rehab the patient so they can become independent individuals.
Point for our viewers, and then we'll be able to say goodbye to you for today. And we really thank you for watching. We want to invite you to become a member of the Global Pain Association. Doesn't cost you anything. If you want to donate, that's fine, but you don't have to. Just go to info@globalpain.org. We want to thank our sponsors for this, our very first panelist broadcast, Global Pain Association, the Eisenberg Group, and Advanced Pain and Spine Center all came together and helped underwrite the cost of this program, and we thank them for that. next Saturday, because we're going to come to you every Saturday in May and June. Next Saturday, May 9th at noon, right here on the Global Pain Association Facebook page. The topic, financial health during COVID-19. Financial health during COVID-19. I'd like to thank Susan Blackwood, who's been working behind the scenes while this broadcast has been underway, and to my wife, Jean Eisenberg, who's been the executive producer and technical director for this show. We thank you for joining us. I'm Ron Aaron Eisenberg. We'll catch you next Saturday at noon on the Global Pain Association Facebook page. Have a great week, everybody. Bye-bye. And Ellen's got her mask on. I like that.